Thank you so much. So I'm going to take a little bit of a different approach. I'm going to actually start talking about the top of the ladder and people in their senior years, and then reverse engineer it back to our youth and then back up to the top. So as John introduced, I'm the president of the Fitness Industry Council of Canada. So we represent over 7,000 fitness facilities across Canada to protect and promote, but really to ensure that Canadians have access to fitness facilities, from your large Good Life Fitness, Planet Fitness, Anytime Fitnesses, down to the yoga or spin studio on the corner. And so the last 5 years, as you can imagine, has been a very busy time for us. But I think it's also really indicative of a change that we are seeing. We spoke about now that we have a Minister of Sport and Physical Activity. That is a really, really positive step in the right direction. For us as the Fitness Industry Council of Canada, when we are doing our federal advocacy, it's kind of like, okay, meet with the Minister of Healthcare, and then, fitness isn't really healthcare. Well, I disagree, but okay, let's go talk to the next person, go and talk to the Minister of Sport. Okay, well, we don't necessarily deal with general physical activity. We're more involved in, Olympic sports and supporting Olympic athletes, and okay, that's good. Why don't you go over to business? Okay, we go over to business now, and then we drown in all of the different groups that are there. And so there was really no place for us to talk about physical activity in Canadians. So I think that now that we actually have this combined Minister of Sport and Physical Activity, we are moving towards what we are seeing globally in other countries that are leading the way. Ireland, New Zealand, who have actually brought all of their organizations together, created a larger umbrella, and the World Health Organization has listed personal physical fitness as a sport. And because of that, it has allowed these other countries to actually go and gain funding and gain recognition. And in a country, for example, like New Zealand, personal physical fitness is actually the #1 sport in New Zealand, more than rugby and all of the other sports that they have that they're famous for. Personal physical fitness is the #1 sport. So I think that in Canada, if we can start to move in that direction and be seen where physical fitness truly is something that should be recognized, then hopefully our advocacy can take us even more strides forward. But I think that we are in a really neat position having our new Minister of Sport and Physical Activity. I think that another neat thing that happened is that, I'm a clinical exercise physiologist. So what is that? I did my degree in kinesiology, and then I did a postgrad in clinical exercise physiology, and I'm certified by the American College of Sports Medicine in clinical exercise physiology. Big long word for saying, the origination of my career was I worked in cardiac rehab, exercising people after they had heart attacks. And then I, after 10 years, started to work more with people who had diabetes, heart disease for prevention, cancer care recovery, mental health, and that's when I launched LiveWell Exercise Clinic. And the reason that I'm telling you this is that I'm somebody who I actually didn't see myself in the fitness industry. I saw myself more in healthcare because I was truly working with doctors were sending their patients to us, and we were supporting people to be more active and to build those habits. These were people who would tell us they wouldn't typically join a gym, go to a gym. They hadn't been active in many, many years, if not decades. And so I think that, again, we're seeing this paradigm shift in that someone who's a clinical exercise physiologist over the course of the last 5 years is now the president of the Fitness Industry Council of Canada. I'm not somebody who, is a big gym operator and personal trainer or any of those types of things. So again, I think it's showing that we're really moving to a place where we have to be looking at our movement as medicine. So again, I think that we are making small little steps forward in those campaigns through all of the work that's been done by so many organizations, including this one. So I want to talk about active youth creates active adults, creates active seniors. And when we have that, we have better health for all Canadians. And how and why is that? Again, in the work that I do, I mostly work with people in my day job at LiveWell Exercise Clinic, with people who are over the age of 55. And I know that the work that we do reduces our healthcare costs. I know that we are able to help people to manage and prevent different chronic health conditions that would have escalating costs to our healthcare system. But I want to tell you about kind of some of the conversations that I have when people first walk through our doors. And a very, very common conversation that we have is, when was the last time you were active? And about a third of people tell us that it was back when they failed phys ed class in high school. That's what they say. The last time I was active was when I failed phys ed. And so I often ask, what does that mean to you? Why do you mean you failed phys ed? And they say, well, you know, I wasn't one of the athletes. I wasn't good at sports. I never excelled in that area. And I failed PE. Now, whether they actually got an F on their report card, I don't know. But in their takeaway, they failed PE. And that is the experience that they then walked away with. And historically, we have made physical activity something that is about performance and physique, and not truly about healthcare, and people understanding how little movement they actually need to improve their health, right? And so these conversations that, again, people 55 plus, that seniors are having, it trickles down to that they ended up becoming sedentary. They ended up, getting chronic health conditions. And now they're starting to exercise because they're in a place where they're saying, I don't have any other options. I need to do something to move my body to get better at this. Another thing that we hear is, again, just I didn't have the confidence. I didn't feel included. I didn't feel that there was a safe or supportive environment for me to go to. And I think that too often we suggest or imply that people aren't motivated, that people are lazy, and that they're not participating because they just, simply they're just, not going to get off the couch and do anything. And I ask us to challenge ourselves. Is it potentially that we don't have the resources and the programs and the places that are inclusive for all different shapes and sizes and levels of fitness of people? Fitness can be really, really intimidating. If you feel like you're walking into a space where people are experienced, again, for these people, it feels like they're walking back into their grade 11 and 12 PE class just to fail again, right? And so what happens is that when we have seniors that are inactive and we have adults that are inactive, they're less likely to have their children participating in activity. If we can go to the next slide. I did something fun just because we are talking about the digital age. I got ChatGPT to create all of my images for me by putting in the topic on the left. So I thought that was kind of a fun thing to do for this topic. But again, when we look at now, if we really kind of go back to youth, okay, so what is it that movement does for us? This isn't about, winning the provincial high school championships. This isn't about winning those types of just winning games and being involved in athletics. It truly is about our mental well-being. And so I think we have to reframe the conversation starting back in youth, because what we know is that, in fact, adults 55 plus are still inspired by younger people, predominantly a very special kind of person, their grandchildren, right? And so we have an opportunity within our youth to still motivate and inspire older generations into activity. And so we know that if we're starting with youth activity, that we are going to actually have a lot of mental health outcomes. We talked about that 40% of youth are impacted by their mental health, and that number increased significantly over the pandemic. And youth are dealing with the highest level of anxiety we've ever seen in Canada. And the beautiful solution to that is that movement is actually one of the quickest things that we can use to improve stress, anxiety, depression. In as little as 10 minutes of moderate movement, we can actually improve our mood. And it's a really, really powerful thing just to do in practice. And it's, even just to kind of rate our mood on a scale of 1 to 10, 10 being a really good mood, 1 being a low mood, and going for a 10-minute walk, and then reevaluating where our mood is, even if it just came down from, or went up from a 4 to a 6 or a 4 to a 7. That's really, really important. And at LiveWell, we get our members every single session, every hour, to rate how they felt when they came in and how they felt when they left, because we live in a world of instant gratification. We want instant feedback. Our kids don't even have to know what it was like to rewind VHS tape, right? Like, can you imagine if we now had a teenager and we asked them to rewind a VHS tape to watch a show, or wait an entire week for another episode of their sitcom or drama? This would be unheard of, right? So we live in an impatient society because we've been taught that. And often exercise is so related to weight that, our body weight, and those returns are something that are very, very slow for us, that we discount how quickly exercise can benefit us. But in as little as 10 minutes, we can improve mood, we can decrease blood pressure, and we can manage our blood sugars. Next slide. So, of course, long-term studies have shown that, exercising can significantly reduce weight gain in the younger age group, and that active adolescents are more likely to maintain a healthy weight as they age. And so again, I think that if we can approach movement more as learning the skills that we need to live a healthy lifestyle, rather than how good are we at soccer or basketball or the different sports that people cannot connect with. Maybe people aren't good at dribbling a basketball. I remember being in PE. I had never played soccer before in my life, and I touched the soccer ball. And I didn't know in soccer you're not supposed to touch the ball with your hands. And the PE teacher yelled over the entire group, and everybody stopped and looked at me because I had picked up this ball. And I never wanted to play soccer again a day in my life because it was so embarrassing for me. I just didn't know, right? So again, I think that if we can embed the skills, then we're building healthier and more active adults and healthier and more active seniors. Next slide. When we are able to participate in regular physical activity, it comes back to my point earlier that we can actually inspire our older generations. So when I talk to our clients that come into LiveWell, and they do share their negative interactions with physical activity or phys ed class or whatever that may be, or inclusion or feeling safe or not feeling intimidated in a space. When I ask them why now, why are you coming to us now to move more? If they have grandchildren, their grandchildren is the very first thing that they say. It's they want to interact with their grandchildren more. It's that their granddaughter or grandson just started playing soccer and they want to be able to get out there and kick the ball around with them. I had a lady just last week share with me that her daughter is now a single mom and has 2 kids, and that she knows she doesn't have the strength and agility to chase after those kids, and that she can't be there for her daughter in a way that she knows she needs to be. And she wants to be able to take care of her grandchildren, but her daughter knows that she can't do it. So she is there every single week, literally training and exercising and doing everything that she possibly can so that she can care for her grandchildren and remove that burden for her daughter and participate in that way. So grandchildren are a huge driver for people. And so when grandchildren are participating in sport, they're participating in movement, they're going out on the trails and walking, they're bringing their grandparents along. And so again, kind of starting at the top of the ladder of where we have seniors and older adults who have had had negative experiences, if we can make a change in our youth, we can still have an impact on our current adult demographic as well as our seniors. And as those youth grow, they will be more active adults. About 47% of active youth are shown to currently be active adults, and 30% of those people highly active in their senior years. So I welcome more of a discussion today as we get into the panel, but I'll let our day move along. So thank you very much.